Hey, this episode was filmed during the COVID pandemic, so for the safety of our cast, everyone is seated 6 feet apart. Also, this series is for information and entertainment purposes only. It isn't intended to be a substitute for professional medical advice, diagnosis, or treatment, so don't delay or disregard professional medical advice based on the information provided. And as always, if this is a medical emergency, dial 911.
Welcome to Going to Health.
For people, from people.
So this one time...
Oh, I'm gonna go get some tasty waves, bro.
In preparation for today's episode, as a comedian, I thought about my first-hand experience with today's topic. When I was growing up in New York, it was very common for people to go to the emergency room for a bagel hand. Apparently, some people thought it was a great idea to use their hand as a cutting board to cut the bagel. Ouch! More stories later. Today on Going to Health, we're going to talk to a brilliant orthopedic hand and upper extremity surgeon. Alongside me are my two co-hosts who will be giving me a hand in today's episode, Haley Murphy and Carlos Castro III. Our accomplished guest today is Dr. Christopher Downing. Dr. Downing has seen it all. Injuries like avocado hand and aptitis, which is from too much texting, swiping, declining calls from your mother. There's also selfie wrist and gamer's thumb, to name a few. Dr. Downing, when my son and daughter were young, I used to say, don't run with scissors. Now I'm tempted to bubble wrap them when they leave the house. Anyway, Dr. Downing, we are so excited that you're joining us to talk about these injuries. Could you tell us about your journey as an orthopedic surgeon?
I grew up playing video games and improved visuospatial perception skills. I think benefited the role I have now as an orthopedic hand and upper extremity surgeon. The time I spent with my father as a carpenter. In addition, I have an athletic background as well as a musical background, and went on to med school at UCLA, followed by orthopedic surgery residency in Philadelphia at the University of Pennsylvania, and moved back to Southern California to USC for 1 year fellowship training in hand, upper extremity, and microsurgery. And so now I feel I've become more or less a human carpenter.
So you're a Trojan and a Bruin?
Yeah, I was conflicted.
So which team do you root for?
Neither. It's easier that way.
So Eileen and Carlos, I have to interrupt because I just am really excited to have Dr. Downing here. We've worked together in a variety of different capacities, actually on the business side when I was working in health administration, and then I actually got to be in his operating room and I was his nurse. I know that you're a big gamer.
Yeah, so throughout med school and college, I kind of backed off a bit on the gaming, and now I have a 5-year-old and it's back in my life again. So
now to kind of what we were talking about as it pertains to gaming, what kind of injuries do you see long-term from gamers?
Yeah, I think the demographic of who's showing up in my office is getting younger and younger. There's a lot of repetitive stress injuries that we're seeing nowadays. Tendinitis of various types, including trigger fingers and de Quervain's tenosynovitis, and carpal tunnel syndrome, which is a neuritis, an inflammatory condition of a nerve in the wrist. And so those usually are in the older population, but again, I'm seeing them in younger and younger patients.
Wow.
So question, you hear people, cortisone shots. Does it mask it? Is it effective?
Yeah, I think it depends on the overall comorbidities or disease processes that are within that patient and if they're older or not. I think the cortisone injections are a tool to bridge towards surgery and prove to patients that are older that surgery is going to be probably the best option for them. But I think in the younger patients who have a better self-reparative inherent potential, I think those patients really, it bodes well to try non-operative invasive corticosteroid injections, and they have a better chance, I think, of faring well with that type of treatment.
So the key word is age, because I've had cortisone shots on both my wrists, but that was in my early 30s, and now I have tendinitis here. I got tennis elbow, yeah. I've had that done. However, it's lasted me 4 to 6 months, and it's back again. So what you're saying is that as I'm getting older. Just
unfortunately,
that shot's not going to work.
Yeah, unfortunately, that typifies.
Take his card
experience.
before the show ends.
Yeah, I got my cards in
Yeah.
my on the back table there.
Right.
What are you doing that's hurting your elbow?
You know, I've been told because of surfing. They said that might be it.
Yeah.
I'm also on the computer a lot.
Yeah.
So I'm like a lot of people now, especially right now with everything that's going on. I've been displaced now at home, working from home. And so, of course, I don't have like the best workstation.
Yeah.
So I know that also aggravates it.
Yeah, I think it's very important to understand that tissue elasticity and plasticity, the ability to kind of experience and withstand that plyometric explosive force that you're generating when you pop up on the surfboard is not unusual. And I see surfers of all ages with various upper extremity maladies, and I think those are good reasons for those things to be happening.
Just
but
wait
you also got to get your ergonomics right at your workstation.
Well, that's exactly. I know, and that's something I do need to work on. I mean, I had it at work, but now I'm at home, so I got to get that different station. But I do feel it like on my neck and my shoulders, and so I think the best thing that I'm trying to do is just stretch it out.
Yeah.
Just wait till you get older. I mean, a number of my friends have carpal tunnel syndrome, they have tennis elbow, and then with my daughter, about 1.5 years ago, she decided to use a very sharp steak knife to get the pit out of an avocado. She went like that, and it went through the pit, and she ended up severing a nerve and a tendon. And she had 2 surgeries because after the first surgery, a lot of scar tissue formed. And then she had that second surgery, not to mention going to hand therapy for a long, long time. But thank goodness she's doing much better.
Probably had about 12 to 24 visits of hand therapy, I imagine. Those are terrible injuries.
Exactly.
Yeah, any tendon or nerve injury.
And that's pretty common these days, avocado hand, right?
Yeah. I think the avocado has its place in popular culture. We got avocado toast, we got avocado on our eggs.
Right.
And it's an amazing food item. It's getting more and more expensive, but I think it fits the mold as a very healthy food item, but you just have to prep it right.
So what is the right way to cut an avocado?
So
not use your hand as a not use your hand as a cutting
do it
board.
all the time.
I wish that you used a butcher knife.
Exactly, or just get takeout. And
How are
go
you
to
supposed to get the
restaurants
pit out of the avocado?
Right. So I think there's a lot of information on this online.
Yeah.
I'm not a kitchen aficionado or connoisseur, and I leave that to people who are more capable of that than I am. I'll wield the scalpel. I'll let others wield the kitchen utensils. I was washing the dishes, and my wife would probably think I'm lying, but I was washing the dishes, and I actually dropped a bowl and nearly cut my ulnar nerve in my wrist. I had a laceration right next to where I blocked that nerve in surgery. And so, leave it to people who do it and do it well. But there are nice videos online, and you basically quarter the avocado, and you put it on a cutting block. Don't hold it in your hand. Put it on a cutting block. Cut it in half and spinning it on the knife, not taking the knife and aiming towards your hand, and then flip it 90 degrees, spin it while cutting again, and then you quarter it, and then you take each 75% of it away. You have the last 25% with the pit, and you just pull the pit out with your fingers.
Right.
And so, in addition, that also allows for a nice peel off of the avocado, so you can get the most nutrient-dense part of the avocado, which is right up against the skin, where it has all these carotenoids that are good for antioxidant effects.
Right.